Hi, Scott.
Hi, Diane.
So nice to meet you. Could you tell me a little bit about yourself personally and your experience with clinical trials?
Absolutely. I'm 35 years old, and about 2 years ago, July of 2009, I was in a diving accident where I dove in some shallow water and I broke my neck at the C3 level. And as a result, it left me paralyzed from basically the shoulders down with no movement or feeling below my shoulders. And I spent several months in a hospital where I was rehabilitated. While I was at that hospital, I was approached by some of the doctors there about a device that they had created that would allow people with paralyzed muscles to be able to cough again. And the reason coughing was so important is, as a spinal cord injured patient, when you lose the ability to cough, you lose the ability to clear secretions in your lungs. And the #1 cause of death among spinal cord individuals, or individuals with spinal cord injuries, is pneumonia. And because we don't have the ability to cough, or our muscles are paralyzed and clear our lungs, we're more susceptible for pneumonia than able-bodied people. And at the time of my surgery, I was the 14th person in the world to receive the device.
Did your family or friends have any concerns about your involvement with the trial?
They were very supportive, very, as I was too. I mean, I had the frame of mind that I wanted to get better, and I wanted to do as much as I could to gain as much independence as I could, even if it involved getting more surgery, having some devices implanted in my body, if it would allow me to regain some independence and also help improve my health. To me, it was really an easy decision to make. But there was a lot of information they covered, and it was an overwhelming process. But the doctors that I worked with were very good at explaining everything, answering all the questions, sharing past results with me, as well as allowing me to speak to other people that had had the device themselves.
Super. Did you say you wanted to demonstrate it for us?
Absolutely. Before I demonstrate, I'll tell you a little bit about it.
Sure.
What it is because my abs are paralyzed, basically the T9, T11, and L1, at that point in the vertebrae, are where the nerves jet off of the spine that allow you to cough and contract your abs. And because those are paralyzed right now, if I try to cough, that's about the strongest cough I can get. So you can imagine if you're choking on something, or something's in your throat, or you're trying to clear some secretions or some mucus that you have down there, that's not very effective. And as a result, they would have to, I had a trach at the time, they'd have to suction me. So I had a device implanted, and what that entails is a surgery where they actually go into your, underneath your skin, onto your spine, and they attach electrodes at those 3 vertebrae, the T9, the T11, and the L1. And then there's a receiver that they place on your abdominal muscles, and that's a radio frequency. Then there's an external device that basically mirrors the shape of the receiver that's placed on your abs, and all you do is just tape that to your body or hold it against your body, press a button, and it sends a signal to the abs, and then it travels around the cord up to where the vertebrae are, and basically causes those nerves to fire up, and it contracts your abs as if you were coughing.
Wow.
So it happens in a matter of seconds, and it's very effective, as you'll see in a minute here. You want to press that #2 button right there. Here we go. And sometimes even causes a little bit of a spasm. But as you can see, that cough is obviously pretty effective, and I think it even just cleared my throat just now. And it doesn't hurt. Sometimes people ask me, does it hurt? It may look painful because your body moves, but it really feels no different than a normal cough that I had beforehand. And because it was so effective, it allowed me to have my trach removed, and that area closed up. And again, both physically as well as emotionally and psychologically, that was a big step. I was very fortunate to be approached by the doctors at Metro, and obviously very grateful that I was able to take part in the trial, but wouldn't hesitate to participate in another one, that's for sure.
Thank you so much,
Not a problem. Glad to be here.
You shared so much learning and lessons for everybody.
Yep. I'm glad to be able to share my story.
Much appreciated.
Thank you.